Hello, and welcome to Your Vote Counts, a nonpartisan public informational program designed to get the public acquainted with the candidates vying for the 2022 general election positions for Congressional District 6, Oregon Senate Districts 10 and 11, Oregon House Districts 17 through 23, Salem City Council, and Marion County Commissioners. These interviews come to you through the producers of Capital Community Media. Collaboration on questions and moderators are from the Association of University Women, Salem City Club, League of Women Voters of Marion and Polk Counties. All 27 candidates for these races were invited, and all but 6 chose to do so. Candidates did not receive the questions prepared by the League of Women Voters ahead of time. Candidates were invited to prepare a 2-minute opening addressing their background and qualifications for the office, and a 2-minute closing addressing their goals for the office if elected. I'm Cindy Condon from Salem City Club. I'd like to introduce Deb Patterson, who is running for Oregon Senate District 10. Candidate Patterson, thanks for being here and welcome. We look forward to your opening remarks before we get into our questions.
Thank you so much, Cindy, and thank you to the League of Women Voters for this opportunity. I'm Deb Patterson, and I'm honored to serve as your state senator in District 10. Regarding my background, I'm ordained clergy in the Congregational Church and have worked in healthcare advocacy for 20 years. I'm mom to 2 young adults, and I'm a caregiver. My husband has deep roots in the area, and he teaches at Willamette. I hold degrees in music, a master's and doctorate in ministry, a master's in health administration from Washington University School of Medicine in St. Louis. I've worked in management of a health system, was founding vice president of a children's health philanthropy, and ran an international health organization which partnered with 15,000 community-based registered nurses around the world. In 2012, I was invited to present the model for our work at the White House. Starting as a student chaplain during the early days of the AIDS epidemic in the 1980s, I've spent my career working for access to affordable health care where everyone is treated equally and with dignity, and for the things that lead to safe, strong, and thriving communities. I've served on numerous boards in healthcare, housing, and human services, and I've been appointed to several governmental boards, from chairing the Marion County Health Advisory Board to serving on the Oregon Disabilities Commission. Others are on my website at debpattersonor.org. In the last 2 years, I've served as chair of the Senate Healthcare Committee, taking on big pharma and fighting for both patients and healthcare providers during a global pandemic. I've also served on the Housing, Natural Resources and Wildfire Recovery, and Veterans Affairs and Emergency Preparedness Committees in the Senate. And in my first 2 years in office, I was able to bring more than $35 million to our district for housing, public transportation, educational opportunities, infrastructure, and small business support. I believe I have the right experience needed to continue to work for an Oregon that works for everyone.
Thank you, Deb, for that opening. And now we'll get into questions. So our first question today has to do with the Infrastructure Investment and Jobs Act and the Inflation Reduction Act. What elements of those 2 federal acts do you think will benefit Oregon?
Thank you. Let's begin with the Infrastructure Act. I'm extremely excited about the funding that's available to help electrify our highways, to put in more charging stations. We like to have a goal of encouraging folks to invest in purchasing electrical vehicles, but we know that more than half in many of our cities of our residents are living in apartment buildings where they just simply don't have access to charging stations. So we do need to make sure we have fast, reliable access to charging as we try to address global climate change here in Oregon. So that's one part I'm really excited about. I'm also really thrilled that there's funding available for water in every one of the communities in our district right now, from Monmouth and Independence to Turner and Almsville, and of course in Salem as well. We had issues related to the infrastructure of our water, delivering clean water and taking care of our stormwater and wastewater. We have to continue to upgrade with the numbers of folks who are moving to our area. So water infrastructure continues to be a big need, and I'm really grateful that there's funding available to help with that. And thirdly, I'm really concerned about the quality of our roads right now. Bridges in particular, I just was at a ribbon cutting over in Independence the other day where they upgraded that to make it so that a fire truck could get across that bridge. You can't have a whole neighborhood where the fire truck or the garbage truck can't get there. They were developing there. So those are the kinds of needs. And and could you remind me of the second one?
The Inflation Reduction Act.
Oh gosh, yeah, inflation right now, particularly with food, when there are so many, gas is coming down. We know the war that Russia is inflicting on Ukraine is playing a big role right now, and that all related to energy, but it also related to food. Right now, food prices are the highest, experiencing the most inflation they've experienced in 40 years, and so I'm grateful for the investments from the federal government to try to address this issue as much as possible. We need to take action on the federal level. The state level is not going to be enough.
Well, thanks for that. And so now we'll move on a little bit to clean energy, which I think you mentioned. And what are your thoughts about the renewable energy tax credits and their effectiveness, or how they would be effective given certainly Oregon's clean energy program?
Well, the renewable energy is something that we certainly have to invest in, as we've seen the climate change rather catastrophically in many places. Some countries are really existentially being threatened right now. Luckily, here in Oregon, the threat from climate change has been disastrous for places like Talent and Phoenix, where they were wiped out by the wildfires, and even threatening South Salem, most recently right in this district just a few days ago. And so really grateful for the work that's being done at the state level here related to Senate Bill 762, which puts in place some strategies. I'm really pleased to serve on that committee, some strategies for dealing with wildfire prevention, mitigation, and recovery. But as I mentioned to another group with whom I met recently when I was over talking with Salem Electric, I really do believe it's important to diversify our energy sources. Our clean energy initiative that we passed here in 2021 related to 100% clean energy by 2035 is an admirable goal, and I hope we'll be able to get there. But there are times when we do need to have access to other fuels, and so the renewable energy sources that we have, such as the hydrogen fueled buses that Chariots are using, renewable natural gas, might be a real opportunity for diversification there. And of course, as I mentioned, hydrogen as well.
Okay, thank you. So now moving on to certainly an issue that has been in the news for a while now, in mental health, and particularly, what steps do you think should be taken to address Oregon's youth mental health needs?
Well, obviously, we need more healthcare providers, and I was really pleased to vote in favor of Future Ready Oregon, which designates $200 million towards workforce development. In addition, this tomorrow morning at 8:30 will be, I realize this will be recorded later, but during legislative days this week, we'll be hearing in the Senate Healthcare Committee about capacity issues. And ambulances are waiting outside of the ERs for patients to be admitted. The ERs are filled waiting for patients to have a bed to be admitted into the hospital. The hospitals are filled with patients who are ready to be discharged to step-down units like nursing homes or mental health facilities, but there aren't enough beds. And so the capacity issues are all the way along the way. The goal originally in the 1980s, as we know, was to have more community-based services, but we haven't kept up with the investments or the workforce in the basic primary care around mental health. So I applaud the efforts in mental health first aid, which is being taught in community-based settings. I am very much in support of school-based health centers that provide mental health services. I've always advocated that our counselors in schools should do more than just counseling for grades, and we need to support the arts, which are very healing as well.
All right, thank you. So now broadening the scope on healthcare a little bit. Do you think that Oregon has the resources to provide adequate and accessible healthcare to Oregonians, and why or why not?
Absolutely. I think we have the resources to provide adequate. We have fabulous resources here. And I do not believe in rationing, but I believe in sensible planning and which to make sure that everyone has access. For example, right now we're planning for a bridge program for those people who, after the emergency declaration of the COVID emergency has ended, will be no longer eligible for Medicaid coverage, no longer eligible to be on the Oregon Health Plan. So we're planning for those up to 70,000 people to have access to affordable quality health care through the marketplace in order to not lose coverage. We're planning now through the waiver process, which is almost complete, which moves forward 5 years into the future for more upstream investments in preventative health. The more, for every dollar we invest in prevention, we save $5 later on. There's plenty of money, but we're spending it at the back end. Right now, we need to invest more in the front end. So that's why I voted in favor of visits of nurses to every newborn in the state. 3 visits after they're born in their homes to help facilitate good lifelong, good connections with the health system so that family can have the resources that they need moving forward. And I support every investment in supporting families related to childcare and good nutrition. These are so important. All the social determinants of health, we've got to invest there. Where there is lots of money, we need to spend it wisely and plan for the future.
All right, thank you. And this may be our last question. If we have time, we may sneak another one in. But just considering the CDC public health statistics on injuries and death from shootings, how do you believe the issue should be addressed and open discussion around guns in our society be enabled?
Absolutely. As clergy, I have stood by the bedside of families who are waiting to hear how their loved one will be doing after being involved in a shooting. And it's not a place where any family wants to find themselves. And we've seen on TV the mass shootings. We know the death by suicide, self-harm with guns, it is much higher than in countries that have universal background checks and safe storage. I'm absolutely in favor of the Second Amendment. My mother was basically Annie Oakley. However, I will say that the vast majority of Americans are responsible gun owners, those who own them, and are in favor of universal background checks and safe storage and other sensible gun laws.
Okay, well, thank you for that. We do have time for one more, I think. What is your experience in working with diverse groups, and how would you bring a broader based policy process into state planning and decision making?
My experience in working with diverse groups is like most Oregonians, our state was historically founded on not being very diverse intentionally. I value and the insights and opinions of the Indigenous people who are the first Oregonians here, and appreciate that their history and their contributions now. I've worked closely with Cocoon and other organizations here in the area who are working with Latinx and others. I am a member of NAACP. But most of the most of the coalitions that are working on progressive values here in Oregon are diverse, bring a wide perspective. My staff is diverse. I think we just need to be intentional and realize we're all in this together. If we want an Oregon that works for everyone, it has to be an Oregon that works for everyone. This morning, I was talking with folks for whom English is not a first language, and how difficult it is to find medical interpreters who might be able to assist them. And so there are so many ways and so many issues that we need to work on together. But I don't think it's one win-lose. It's win-win when we work together.
All right. And lastly, what steps should be taken? Oh, sorry, excuse me. What is being done to support county election officials and support staff as they conduct election duties coming into this general election? And is there anything else that should be done?
One of the things that I really respect about the county officials, both in Marion and Polk County, which are the two counties in that this district is a part of, is the transparency of all the information, the number of the voter statement pamphlet that comes out online in different formats for people with disabilities who aren't able to read, aren't people who are intellectual and developmental disabilities who need a more simple format. And then the vote by mail, every effort to make sure that elections are free and fair, and especially the diligence in making sure signatures match up. We have fantastic county clerks, and their staff are doing a wonderful job. I just support their transparency, and I think it's there.
Thank you so much for that, candidate Patterson. And now you're invited to share your 2-minute closing comment about your goals for this office if elected.
Well, again, thank you so much, Cindy, and thank you to the League of Women Voters for this opportunity. If I'm reelected this November, I'll build on the work I began 2 years ago to make healthcare more accessible and affordable for all, and will continue to stand up to Big Pharma on drug costs here in Oregon. I'll continue to protect reproductive choice, and will work to grow the healthcare workforce for hospitals, long-term care, dental health, and mental health services. I voted in support, as I mentioned, of the Future Ready Oregon $2 million investment, as well as a $470 million investment in growing mental health services across the state. I will continue to work for making more affordable housing available and supported services for those who need them. I was pleased to help secure $7.5 million for a navigation center in Salem to assist those who needing housing, along with several other housing programs for homeless youth, veterans, women leaving situations of domestic violence, those affected by the wildfires, and others. I'll continue to work on climate action, addressing needs related to water use and sound forest management to prevent catastrophic wildfires which threaten lives and homes. I'll continue to support our students and teachers in public schools. I was proud to vote for an historic investment of $9.4 billion for our K-12 schools. I was able to designate funding for 300 scholarships for bilingual education majors at Western Oregon University, and designated additional ARPA funds to the Willamette Career Center in Salem. I'm working with Rep. Evans to help provide more resources to our Oregon State Police for health and wellness, including bridge healthcare upon retirement, and will continue to support sensible gun laws like universal background checks and safe storage to keep our families and first responders safe. I'm out every day in this district, which includes South and West Salem, downtown Salem and Four Corners, and Monmouth and Independence. I look forward to continuing to serve this district and our state in the coming years. Thank you.
Thank you, candidate Patterson, for our interview today and for sharing your thoughts.
Thank you so much.
You bet. Thanks to Capital Community Media for their extensive technology and producer skills used to create this program. Thank you to the League of Women Voters of Marion and Polk counties for the design and preparation of the program, and to AAUW Salem City Club for help with the question development and providing moderators. And thanks to you, the public, for watching in order to become a more informed voter. For more local, state, and national voter information on candidates and ballot issues, visit vote411.org. You have until October 18th to register to vote to make changes. Ballots go out October 29th and 20th, and according to new law, will be accepted and counted if postmarked before or on November 8th. Elections do matter. Remember to vote because your vote counts. Look, thanks very much.